I'm Liz Cambron, and I'm the content manager with Beyond Type 1 and Beyond Type 2. And so I'm really excited to talk to you today to Dr. Paul Givargis about 9 a.m. Health and the programs they have for people with type 2 diabetes. If you can introduce yourself and kind of how you got to this position and how 9 a.m. Health got started.
Great. And really nice to meet you, Liz. And thanks for the opportunity to share the story. So Paul Givergis, I'm one of the co-founders here at 9 a.m. Health and the chief medical officer. A little bit background on myself. Born in Queens, New York, if you want to go all the way back. Lived most of my life out in New Jersey. I had, two parents that were born in India, but, immigrated to the US. And I had one lucky side to that my mom was a nurse. And I think I had the ability to live in a life of health information privilege, if you want to call it
Yeah.
that, where she at least, she was a night nurse, but she knew her way around the healthcare system. And I grew up with asthma. So there was a benefit that is there. And I don't think that benefit exists across everybody that has a chronic disease or any other condition. And I think it's really important that we're able to provide information and care for everyone that needs it. I went on to become a pharmacist. I went on then to provide care through my clinical training and had the opportunity to provide some care in Native American reservations out in Gallup, New Mexico. And that's where I really had the opportunity to see the effect of chronic diseases, especially diabetes, in underserved populations. Really with that, went on to do a postdoctoral fellowship in diabetes and obesity. And then I went to work with Novo Nordisk, which is one of the leaders in insulins, but also in GLP-1 receptor agonists, and really had an idea of the manufacturing process, but also really how patients get the medications that they need, but also how there's gaps in some patients not being able to get the right medications and not being able to afford the right medications. I then had the opportunity to come out from the East Coast to the West Coast to work with My Sugar. Actually, two of my co-founders were there from the early days of My Sugar, and they both live with type 1 diabetes themselves. And I think it gave us an understanding of the journey of people with diabetes overall. And we now have an amazing opportunity to be able to bring the entire experience together, both from the doctor's side, from the pharmacist side, but also the labs and the medications and everything in between there. I think it was really easy to see that there's one too many drop-off points in the diabetes care experience, whether it's just not having time to get your labs or having time to pick up the medications. It's just a hard system to deal with, and that's where we really wanted to solve that and bring the entire experience together.
That's awesome. I've never heard anything like this before. So for other people who have never heard about 9 a.m. Health, what is it and who is it for?
Yeah. So 9 a.m. Health is a virtual diabetes clinic. So we serve people with type 2 diabetes and prediabetes, and we help them get care from all the way from the physician visit, all the way to the labs, to the doctor's visits, to the medications that they're getting, and then also the care in between. So we have a team of pharmacists, dietitians, nutritionists that can help for those points in between. It's a solution that any one of us can go online through our web portal and be able to access and get linked up with these resources. It starts, we really want to be affordable, so it starts at $20 per month, and depending on the number of medications and labs that you have, services get layered on top of that. But who's it for? I think that's a really important question. So we are serving people with type 2 diabetes and prediabetes. But we also help with some other conditions that they might have, like high blood pressure or high cholesterol. And when you really think about who is it for and who's it best for, I think anyone that is kind of tired of the existing healthcare system that revolves around diabetes, whether it's the copays that exist across all elements, whether it's the wait times to get an appointment, whether it's the fact that sometimes you have to take a half day off to do things like getting your labs. Anyone that's tired of that experience, I think then we have the right solution for you to be able to do it and do it in an affordable way. But then also anyone that is looking for the right support system, from the pharmacists to the dietitians to the clinicians themselves, and having the resources at their fingertips, that's exactly where we've positioned ourselves.
Awesome. I know personally, when I have to look for a new doctor, it can be months before I can actually be seen as a new patient. So on average, how long does it take for someone who's joining 9 a.m. Health for the first time to actually see care team to see a provider?
Yeah, that's such a good question because I think right now with the pandemic, that problem's gotten even worse in terms of how
Yeah.
long wait times can be to get in to see a provider, especially if you don't have like established care or you're a new patient, which understandably people don't want to go into doctors nowadays for health reasons, which makes total sense. And then if you're outside that system, you're kind of trapped outside that
Yeah.
system. We have a way to get in where basically you come to our website and then you actually put in your health information, you all the relevant details that are important for us to create a treatment plan. And those treatment plans and consultations happen usually within 24 hours, but in most cases, actually within 15 to 20 minutes. We're actually getting linked up with a physician or someone on the care team itself. And I think it's kind of crazy when you compare it to what exists out there, but
Yeah.
also I think we're all consumers and we have expectations, whether it's with Instacart or Uber, that things
Yeah.
do come in 15, 20 minutes or 24 hours. And we want to rely on those expectations and keep that bar there. So that's how we've built the system.
Awesome. Yeah, that sounds great. So what aspects of diabetes management does my name help with?
Yeah, no. So the way we've set it up, we have this baseline level of services with the physicians and with ongoing labs and medications. But beyond that, our care team is trained around several different elements of diabetes management. So from handling your medications to responding to glucose values, to understanding your labs, but also very importantly, to go one step also into the mental health space and to be able to help with coping and diabetes distress, because we know there's a ton of stigmas that exist around type 2 diabetes, and we want to debunk that alongside patients to be able to say, hey, there is a number of factors that are the reason for your type 2 diabetes, and partially genetics, partially other risk factors. And we want to be part of that process. And because of that, existing stigma that's out there, mental health is a big part of the process. Our educators are trained around that. In addition to that, the program we've created, it's based on a team of healthcare providers. So, some of the big inputs we have a medical advisory board. And on that medical advisory board that creates our programs, we have an endocrinologist, so a specialist in diabetes. We have a researcher who actually specializes in insulin. And then, probably most importantly, is a psychologist, a clinical psychologist who actually runs the Behavioral Diabetes Institute. And just to be able to leverage the expertise in building our programs there too. So I think that multifaceted approach where we're having different areas of the program, but also different specialists across the program is really important to what exists in this program.
Awesome. And so someone comes to an appointment, but I think one of the biggest gaps for people living with diabetes is that when they're not in an appointment face to face with a provider or screen to screen with a provider, they spend most of their time on their own. So, what resources do you provide to help people with self management after they've left their appointments?
Yeah. So that's a extremely important thing that you're bringing up. When you think about it, when you leave a doctor's office, you might get some kind of printout that's directly from the
Yeah.
system, or a handful of pamphlets, and that's where we want to change that system as well. And what we do is we have certain resources that are fully within the technology we have. So, for example, when you get a medication and it arrives to your doorstep, because we also deliver the medications too, when that gets to your doorstep, you'll either get a phone call or a message that teaches you a little bit about the medications themselves. So it's really timed with the journey itself. And then the care teams also will reach out at certain points. For example, if there is an increase in your dose, it's hard to remember after 7 days that I'm supposed to take 2 tablets. So we'll reach out or we'll send a message out through there. So there's some more of those interactive resources that we have. In addition to that, I'd say our teams themselves are the biggest resource. I think having that person to be able to reach out, after a 12-hour shift or during your lunch, where you can ping them a message, whether it's about your medications, in which case our patient care advocates would route it to a pharmacist, or if it's more something for the doctor, then it would get routed to the doctor, or for one of the dietitians, a food topic or some other care topic, it would get routed over there. So I think that's also the biggest resources around this team that's available at your fingertips. And it's really, a privilege to be able to put together the right team so as to take some of the thinking
Yeah.
away from an individual as to what to get into. The last part of the resources I'll say is, we put a lot of information out through different avenues outside of a pamphlet, which is maybe a video, for example. You'll get some videos through our system. But also when you see in our social media, for example, on our Instagram accounts, we like to put education out there. And part of that is coming back to my earlier point about health education and how it should be accessible and should be a privilege for all. And we're not going to put our education behind a paywall. We have our our journal. It's a blog, and we're putting educational information through there. We have our Instagram account where we're putting tips and education through there, and we're going to continue to do that. Just whether you're a member or not, you're going to be able to access that education and get the right trustworthy information out there.
That's great. So for someone who's interested in managing their diabetes with 9 a.m. Health, is this in replace of their primary care provider, or is this in conjunction with?
Yeah, we have a little bit of both when we look at our patients. I think the easiest way to think about it is if you have a diabetes specialist, sometimes that can coexist with the primary care doctor. And in that case, we'll communicate with those primary care doctors so that we have the same set of information, and we'll try to base things off that. But then in the end of the day, then you have a specialist in diabetes in your field, just the way someone that needs to have GI issues or stomach issues, we'll have that specialist as well too. But we also recognize that, especially during the pandemic, there's a lot of people that maybe don't have access to a primary care doctor. So we do want to be their primary resource for those people around their diabetes, around their prediabetes, around their high blood pressure, their cholesterol, and then also point them to the right referral networks or the right networks to be able to help with some of the areas as well. So there's a little bit of both there, so we can accept as many patients as we can.
Okay, so it sounds like you're able to communicate with other healthcare providers, so it's not like someone with diabetes has to balance, two different things, because I feel like that can be overwhelming when you have to manage two different systems that way.
Yeah, and that's almost the thesis of the entire program. As many of these providers as we can bring internal to our system, we could take that burden away from an individual from having to think, okay, this is a side effect. Do I ask my pharmacist about this, or do I ask my
Right.
physician, or maybe I'll call one and they'll route me to the other one. So
Yeah.
as much as we can route them in, and that's why we have this team called patient care advocates. They're people that are in your profile, able to understand, who are the teams and who are the healthcare people that we can point to, and what other resources can we point a person to that's there as a dedicated resource there.
Awesome. And so does someone have to get a referral like they do to see an endocrinologist? Do they need a referral for 9 a.m. Health?
Yeah. So I find the referral process on its own to be one of the most painful elements of
Yeah.
healthcare. I think about like the example of having a stomach issue where you might have to speak to a gastroenterologist, a specialist for stomach.
Yeah.
But then you have to go through a referral system to be able to do that. It doesn't, make so much sense. So for us, no referrals needed. You actually don't even need to have insurance to be able to come into our program. You actually just go directly to our website and you can enroll and get matched up through our care system directly through the website itself.
Awesome. And so you mentioned insurance. Is there any aspect that insurance does cover if someone does have insurance, or
Yeah,
Medicaid or Medicare?
yeah. So currently we're not working through insurance, and I think we wanted to go live as quickly as possible to be able to get our services out there. And also very importantly, to be able to be as efficient as possible with the resources that we have, knowing that not everyone has insurance and not everyone has the best insurance that could be out there. So we're currently not accepting insurance, but it is on our roadmap, knowing that some people want to go through their insurance for these things. So either to accept insurance for medications specifically, but then also to get completely covered with insurance. It's not something we have now, but it's on our roadmap for the future. In the meantime, we're trying to keep our programs as affordable as possible. Again, staying, with starting at $20 per month. A lot of times that's cheaper than some of the copays that people have. So yeah, that's our thoughts there.
Okay. And so you mentioned that you can also help with other conditions that people with diabetes might have, like high blood pressure and high cholesterol. And you offer at-home testing for A1C, but how do you handle testing for other conditions like those?
Yeah, so we have something called a dry blood spot kit that we utilize to get A1C tests. We also use that same test for lipids, so for your cholesterol levels as well. So we can do that, and we can even do some kidney markers through there as well. But very exciting, actually, we started a partnership with a company called Scarlet Health. So within the upcoming months, we'll be able to actually launch with them. And we actually have our first test patient through there, which I've been super excited about, where we'll actually have a phlebotomist. So the person that draws your blood come to your house. And with that, obviously there's a convenience factor right there
Yeah.
in terms of not having to step away from the home or office for the extended period of time, but also we'll be able to get even more labs and markers of your metabolic health through that. We'll be able to get, for example, comprehensive metabolic panels, which will tell us things about your electrolytes, your kidneys, your liver, all kinds of different labs that are necessary for treatment and necessary for managing a whole human at the same time. And we'll look to basically expand what labs we have and what conditions we manage based on basically what our users say they have. Whether it's hypothyroidism or whether it's heartburn or allergy or asthma, we will go by basically what our patients are actually having and how we can help them the most.
Okay. And so you have a list of medications that you are able to provide. If someone needs a medication other than those, like insulin, how do you handle that?
Yeah. So right now, the list of medications we have is what enables us to be able to have such an affordable price point for people to be able to join. For medications like insulin, where there is a higher price point, and as well as some other medications like GLP-1 receptor agonists, we offer certain pathways where we potentially switch them over to a more affordable medication. If that's something that their situation calls for. For example, maybe they don't have insurance and they just can't afford some of the more expensive medications. There's a better therapeutic option than just not getting care and not getting the medications. But then, furthermore, we will in the future look for partnerships, and we've already started conversations with some of the insulin makers as well as some of the some of the generic companies to be able to actually have additional medications that are then going to come into our formulary that we'd love to add. And then there's the option in the future of actually getting it covered by insurance, which will also enable us to have those additional medications. In the interim, if someone is on one of our medications and then needs to go into another medication that we don't offer, we're also able to transfer it over to another pharmacy that's maybe local to them so that they can also pick up some additional medications, whether it's through insurance or not.
Okay. And so a big thing that's changing, I think, is the use of medical technology. And so are you able to prescribe like continuous glucose monitors?
Yeah. So right now we're just in the process of going live with blood glucose monitors because we know blood glucose testing is important. But at the same time, we know the value of diabetes technology such as CGMs, continuous glucose monitors, and we know that value. It's proven in type 1 diabetes, and really it's being proven in type 2 diabetes as well too. To be able to show how your body responds to certain foods, how your body responds to certain stressors. And we think that's very important also for people with type 2 diabetes. Currently, the pricing of these CGMs is just not where it needs to be for us to be able to, offer this to patients and expect that they can pay it all out of pocket. We do see some trends happening and some costs that are lowering, And then also when we are able to accept insurance, then we can also do this. We're developing a model also out where you'll be able to have it certain times throughout the year. So maybe not 24/7, but maybe once every 3 months or once every 6 months, and still get some of those insights for our patients. And we'll hopefully develop that out and be able to offer that and prescribe that within our ecosystem as well too. So it's actively on our roadmap.
Awesome. Yes, keep it on there because CGMs have been super helpful for a lot of people. Um, and so we know who 9 a.m. is 9 a.m. Health is for and who can use it. Is it available for people who don't necessarily speak English or that are hearing impaired?
Yeah, so it's really important to us to start to offer to all populations. So our care team and our patient care advocate team has Spanish-speaking representatives on each team, so that we can meet the needs of Spanish-speaking language speakers. We don't have additional languages than that, but that's where we've started on that side. And then on the hearing impaired side, actually haven't been asked that question before, but in reality, since a lot of our technology goes through chat, there's actually a great ability when it comes to hearing impaired to be able to actually do the whole interface through chat. And in that case, it's a great solution there too.
Okay, awesome. What type of technology do people need to be able to access 9 a.m. Health and its resources?
Yeah, so I think it's as simple as either a smartphone or a desktop computer or a laptop, basically anything that has a web browser in it,
Mhm.
and they'll be able to get started. Once they're started and in the program, at that point, anything with the phone line and again, maybe a web browser to be able to access certain messages is going to be enough to be able to access these services so that we can really get as many people on board and accessible to this.
Okay. And my last question is how much success have you seen with people using 9 a.m. Health to manage their diabetes?
Yeah, we have our patient and care advocate team that every day is talking to individuals within the 9 a.m. health ecosystem. And it's really exciting to hear the feedback that we're getting from every individual. We have people that live remotely, so maybe an hour and a half away from a normal town or doctor's office that just weren't getting care before because it's too far and too expensive with gas prices to
Yeah.
actually get out there. And they've been super excited about it. People that just don't have time in their lives to be able to manage care and would rather push it off, they've been super excited about it. And then anyone that's price conscious or time conscious, they've also been really excited about it. So the feedback we've been getting from our users has been tremendous, and we're just excited at this point to be able to serve them and provide care to areas where people just don't get care, like areas on the map, areas where they might have just fallen through the cracks of the healthcare system, that we're able to serve that population. And it's something that day by day only keeps fueling us with every additional patient that comes on board. So the feedback has been really exciting so far.
Thank you for speaking with us and for sharing information. If people want to get more information, where can they go?
Yeah, so they can go to 9am.health. So www.9am.health. And it'll have all the information there, all information on pricing. We try to be as transparent as possible and have as many offers as we can to be able to get people on board. So everything that they need should be on there, but also feel free to check us out at 9am for our Instagram. And then you can also find some more information and, like I mentioned, education there too. But yeah, it's all available on the web to be able to check out. Thank you, Liz. It was nice meeting you.
You too. Thanks.